Elizabeth Suzanne got an appointment with, I think it's Whitmire. Did she email that to you? But it's for the 14th.
No, I don't see it. I'm sorry, I'm trying to field my inbox right now. I'll be right back.
Okay.
So it looks like we're up to 88. It's been there for a while.
I have 90. Well, that's us too, right?
Correct. Thanks, Marcus, for letting me know. So there's a really great question in the chat from David. I don't know if anybody wants to take that one. It looks like we've got Tim had raised his hand.
So I'm going to address the question in the Q&A about the advocacy for 501c3.
Cynthia, let's wait just a minute and let a few more people rejoin.
Yep, we're back up to 92. Or up to 92. By 93. I should keep counting because it keeps getting bigger. Andrea, you might not be able to see the questions that were from the last session, but hopefully you can see the ones that have been posted since we rejoined this meeting.
Yeah, Elizabeth sent several of them to me, and I think I remember the gist of the rest of them. So
Yeah. All great questions.
Yeah, let's just give it a few more minutes. If you typed a question in the other chat, if you want to go ahead and put it in again, I'll be happy. That would make it super easy. Otherwise, we do have most of them transferred over. We're going to give everybody just a couple of more minutes, and then we will get started. So we are still ahead of schedule, so.
Jason, somebody, Marcus Brewer says the link says the meeting starts at 9.
Yeah, yeah. In my haste of creating a new webinar, I didn't notice that. It's still, well, obviously it's allowing people in, but to his point, some people may think that we took a break to 9. So that was not my intent. Another mistake to put on the board today. And just
No counting, Jason.
I count.
No counting.
Yes, I agree, Angela. Gotta love Zoom.
And Rick, right now you're not seeing the questions because most of them are coming to the panelists instead of to the group. When you are posting a question, if you want to choose, it can go to all panelists, to each of us individually, or to all panelists and attendees in the drop down when you're sending your questions in.
Thanks, Justin.
Everybody's going to give you a break, Jason.
Absolutely. So
We
if
all-
all of you that have already gotten in, if you need a quick cup of coffee, water, anything, I'm going to give it just a couple of more minutes because of the 9 o'clock time that they may have seen in their link. And then we will get back started. I promise you we're going to finish on time because we, as I said, had all the fast talkers up front. So we are ahead of schedule. Even with our technical difficulties, we're ahead of schedule.
Yeah, I just said I was going to answer a question live. And so I don't know how we're actually, it just came to me. It didn't come to the full group. So,
Oh, you've got a different question. Okay,
yeah.
which,
Okay, so I had a question that basically was talking about, would it be acceptable to speak about the continuum of services after a client discharges from a rehab facility? And what they were really trying to say it was to get to the importance of HB4, which is a bill that is being heard today, actually, that is going to allow all of or much of the emergency processes that were put in place to be able to deliver behavioral health services as well as physical health services via telemedicine and telehealth. We are certainly, this is a bill that we are supporting, especially because we've seen the successes that has happened, especially when it comes to reaching rural areas for those people with transportation problems. And we would like to continue those services. This is an important bill in order to carry forward our ability to do them and do them fairly easily. So the answer to that question is yes, it is acceptable to speak about the continuum care after discharge and to refer that to like recovery support services via telehealth is certainly a part of the whole scenario of why HB4 is important. Did that answer the question?
And Cynthia, we're gonna go over each bill individually when we get to those bill sheets, and that is one of the ones that we'll address.
Okay. And I will not respond that I answer the question live to the next time. You want that person to think that, oh, I didn't answer it. And I said I did.
okay, so we seem to still be experiencing some technical difficulties. We may have a different 100 people with us. We may not. But we are going to just go ahead and roll with what we have. So I do want to go back and answer a few questions before we get started. I want to make sure that everybody, so yes, I've seen a number of things come across about appointments. And I will say there's a link, and Jason, I believe you just dropped the link in to the chat that has a list of all the appointments that have been made. And it has the links to the appointments. It has who lives in those districts, everything with that. So please download that document out of the chat and you can see that. So then moving on, we have a question about the issue of advocacy. So we normally cover this question in the ABCs of advocacy, but we may have some people that weren't with us back in November when we did that. There's always been a question of, can you lobby or not as a 501c3? And what's the difference between lobbying and advocacy? So what you are doing today is advocacy. It is not lobbying. and you absolutely can do it as a member of a 501c3. In addition to that, if you are an ASAP member, ASAP is a 501c6, which actually allows you to move into the lobbying. But if you say that you are here as a member of ASAP, that also provides you that coverage to share more information. So really for me, the way I always kept it in my head is advocacy is educating that person on the entire field, on specific issues around the field. Where you get into true lobbying is when you're working a bill, when you're asking them to move a bill into committee, to vote a certain way on a bill is when you get into lobbying. And that's what we're not asking you to do that today. We're asking you to educate them about the bills that are in front of them, what those bills will do for their constituents, and to look at supporting them, which is different. So you absolutely have the ability to do everything that we're asking you to do without ever endangering your 501c3 status. So hopefully that answered the question for that. Let me double check real quick with some other questions that came out. We were starting to talk about those follow-up methods, and Cynthia, you had kind of mentioned follow-up. Would you like to cover a little bit more of that about following up with people after the visits, or Sherry, either one of you?
We actually have a whole section for that toward the end of the session.
Okay, great. So we're going to have a whole section for that later. We had another question about an example format for the Zoom appointment. I believe we have that coming up next as well. So we're going to cover that. Let's see. So is there a team appointment or individual? In most cases, it's going to be a team appointment, but there will be some, like I have a state rep that I'm the only person registered who lives in that district. So that would be one thing. And then I think we're going to cover those. And then there's a question around the protocols for addressing your senator, what to say, open and greeting. Of course, I guess let's start with some of the basics. Is it's always, no matter how well you know them in a more formal setting, it's always Senator whoever. Thank you so much for meeting with us. We really appreciate your service to your constituency and the time that you're giving us. Would be kind of how I do that. Sherry may have a little bit different style on that, but you want to use, when you're writing, it's honorable, but when you're speaking, it's either senator or representative. There is a question about what if there isn't a link with your area's senator. If you could drop in the box which senator that is, I will double check on that while I turn it over. I believe the next on the agenda was going to be Elizabeth talking about some of our meeting etiquette and some tips for that. And you are muted, Elizabeth. There you go.
All right.
Welcome
So just to be clear, that's not my room. I just want to let y'all know that is not what my room looks like. But not all of us are prepared to work from home. I'm pretty fortunate that I work for a virtual organization, so having a home office is something that I had already established in the before time. So right now, some of us, working from home, our office is set up in our bedroom or maybe at a kitchen table. It might be the only quiet place we can find is on the back porch. And that is completely fine. But there are a few things, especially in meetings like this, that we really want to pay some close attention to. The first thing is, please try to find a quiet place. If you have dogs that bark a lot, if you have kids that make noise, I don't know any kids that don't, but in case you have some, just think about the timing of your meeting and what's going on during that time, and maybe plan a little bit ahead to have some interference in that. Just a real life example for me, I have a cat that for some reason is really attracted to Zoom meetings, especially the ones that are with people I don't want my cat to appear in. She likes to stand right here and do her thing. So during this webinar, I have someone controlling my cat, if you will, so that doesn't happen. I know that's not always the case with everyone, but it's just about planning ahead and, you know, trying to compensate for some of these things. If you're not talking, put yourself on mute. Another thing also, please turn your phone on silent or vibrate. I have a meeting that I go to every weekend, and there is a friend of mine in this meeting that has never ever once turned her phone off or muted herself, and her phone announces her phone calls. So in the middle of a meeting, we get announcements of all these people that are texting her and emailing her. So please, please, please put your phone on mute, or at least vibrate. If you have to get up from where you are sitting, please turn your camera off. Other than that, it's really important in meetings like this to be present and have your video on if you can. We want to make sure that our legislators and their staff know that we are present and really engaged with them. And when we don't have our video on, they have no way of knowing if we're actually present in the room. And so that's really important as well. Another thing is, if you can, please, this is just part of planning ahead, find a way to keep your camera stable. If you're on your laptop, maybe set it up on a TV tray if you don't have a desk, or on the coffee table, on the kitchen table, someplace so that your camera's not doing this the whole time you're talking to someone. It can make you a little nauseous, but just, it's that more professional type of engagement that we're going for with this. And then finally, your attire, your dress. Please make your bed, be aware of what's behind you. I've got my favorite Janis Joplin poster on the wall, but you can't really tell what that is from the angle of where my camera is, right? And so being aware of what is in your surrounding. If you have a roommate, a spouse, a partner that likes to walk around half dressed, maybe it might be, this has happened, maybe it might be better for them to be in front of your camera where they can't be seen, or ask them for that 30 minutes that they not come anywhere near where you are. But again, it's just making those plans ahead of time. Also, people coming in and out of your room, dressing appropriately. We're at home. We might not want to put on a full suit or something like that, or church clothes, and sit around in them all day. I know I don't want to do that. Comfy pants are great. I highly recommend them. But from here up, we need to be professional. And that means, combing my hair, putting on a more professional top, making sure my makeup's on. It's those kinds of things to prepare for this visit and to let them know that, we're being very intentional in what we're trying to do to meet with them. And so it's just those little etiquette things that can really make a huge impact on how people respond and receive us. And it's really very important that we think about what these things are that are happening in our surroundings when we meet with people. So I don't know, if I'm assuming in the last year, y'all may have had some experiences that may show you what not to do in a Zoom meeting. But again, if you're not talking, keep yourself on mute, keep your video camera on, and stay focused and present. Please turn your phone off as to not disturb the rest of the meeting, and be aware of naked people walking behind you. Just to make sure that doesn't happen. And again, try to keep pets and kids occupied so that you can have that full engagement. But again, this is technology, and the world that we are living in right now, things happen. I don't know if you've ever tried to fight a cat not getting on something, but it's not a battle I'm going to win. So at the end of the day, sometimes she's just going to appear and there's nothing I can do about it. But I do try, and that's really what we're asking here, is just to put forth a little bit of that effort to be more intentional and mindful about what we're doing and who we're meeting with. So that's all I got.
Great. Thank you so much, Elizabeth. We're going to move on. I believe my agenda says now back to Sherry to talk about appointments, what to do if you don't have an appointment, and how to handle some of the rest of today. Sherry.
Thanks, Amy. If we get to a point in time where I never have to have another Zoom meeting, I will be a happy, happy girl. They're just challenging. There was a tremendous amount of email communication in the last couple of weeks around appointment setting, and everyone registered, unless you registered Monday or later, everyone registered should have received an appointment giving you information. Either you were the only constituent in your district and you were asked to make that appointment for yourself with instruction on how to do that. You were you were asked to be the lead for a representative's district and make the appointment, and that there was other people who would be joining you for that. And then we also had a district lead for each Senate district, and those district leads were responsible for making the Senate appointments. As we've mentioned, 2021 is a very different kind of session, and we were able to get appointments with almost all the senators. We had some that finally came through at 5 o'clock yesterday. We have some that we're still hoping might come through this morning, but there have been some appointments where, there was one senator that we had 3 people who literally called for 3 weeks, and the phone was never even answered. Emails were sent and they were not replied to. And so there are some cases where there's not Senate appointments, and I'm personally am very sad about that, because I know it's a little bit anticlimactic for you to do this and be in that situation. With representatives, we have some representative appointments made, and then there were a whole lot that just weren't able to be made. And so so I want to go over kind of what, where to find what we have, and then what to do if you don't have an appointment. Let's see. Jason, will you click that link for us, or somebody click that link for us? It's not working for me. Says Vicky Key, you have your virtual hand up. Would you put your question into the chat box, please?
Since I switched, I don't know if you can you, did my share screen show the document, or is it, did it stop?
Yes, we have the document. Thank you. There's a link in the chat box, and you can go to your Senate lead. These are Senate appointments. Your Senate lead was to set up a Zoom call and send you the Zoom information. So if you were registered in that district prior to Monday, you should have you should have received a link. We tried to gather all those links and all that Zoom information and put it on this list. So if you haven't gotten that, or if you're someone who joined Monday or Tuesday, you would be able to see the time and come in here and click the link, and or get the meeting ID and the password. So this information is available to you, and I know that Kim Simmons has an appointment for Senator Nichols. We just have not gotten her Zoom information. I do believe that she sent the Zoom information to all the people that she shares Senator Nichols with. I know also Senator Blanco, that appointment was made, and I believe Guillermo sent that information to the group of constituents. Jason, can you scroll up, please?
So that's the top. There's
Scroll
sorted.
down. I'm sorry, scroll down. I always go the wrong way on this. Brian Birdwell, Senator Birdwell, I know that Cole has worked very hard on that. He was hoping, he had some hopeful communication late yesterday, and he was hoping to get that finalized this morning. So Cole, if you have gotten that, if you would send that Zoom information out to your group of constituents. And then if you'll continue to scroll, Jason. I know that J.R. Blanco was working very hard on Senator Lucio, and they had a lead late yesterday. I think they were going to try to go back again this morning as well. And then Senator Springer, Brad Fisk was set that appointment up. The appointment is there. And so if you share one of these senators and you have not gotten that Zoom invite, you're welcome to email the person who set up that meeting and ask them to send you that information. There were two senators, Senator Whitmire and Senator Bettencourt, that we have not been able to get appointments scheduled with. And so and there's some fairly large constituent groups for those two senators. And we are frustrated with you that that didn't happen. On the House appointment info, Jason, if you will click to the other, here we go. And as I said, we have 150 House members in Texas. And so there is, we never get them all, but we tried to get appointments. Well, we tried to assign leads to get appointments. We don't do those appointments ourselves. It's just too many. And so there's information in here on those that we did receive. So appointments were scheduled, we had the session this morning from 8 till 11, and we hope to be finished by 10:30. It's our plan to be finished by 10:30 so that you can meet together with your senator group from 10:30 to 11 and organize how that appointment should go. I have, and so the Zoom link that's in there, my thought is that y'all could click into that Zoom for a few minutes and prepare for your meeting sometime between 10:30 and 11.
The only caveat to that, Sherry, would be like one of my appointments, they sent their Zoom link, so we won't have access to that. And I will say for those of you in Hinojosa or Zaffarini's district, I actually have meetings all the way up to 11:30. So I sent instructions through email last night to those groups. But I'll be on there to lead those. So the good news is we have district leads in many of these that will help facilitate those conversations and walk you through them.
Anderson Nash, you said, are we allowed to join any of the appointments that were made or just those that focus on our area? For example, I'm here for recovery bills. Each appointment will have some focus on all three areas. There's not a specific appointment for recovery bills or recovery housing bills. So all of these Senate appointments will cover something from prevention, something from treatment, something from recovery. So there won't be a senator to say you should go to this because they're going to talk about the recovery issues.
Sherry,
yes.
I'm sorry, I just remembered one of the questions that didn't come over from the other chat was, could they join other appointments as well beyond their scheduled? So my thought would be this is a Google Doc. We will continue updating things if we can. If you serve constituents in another area, then I think it would be appropriate for you to join. Say, for instance, you are in on the Houston meeting, but you also serve people in Tyler, then it would be okay. But honestly, they want to hear from people in their district first, and then second from people who serve constituents of their district, but they, in general, are not big fans of people that don't have anything to do with their district spending time with them. State representatives are very focused on their constituents and state senators, if that makes sense.
Yeah. And if you're new, also some of these groups have coordinated as to, who is going to speak about what issues. And so to have somebody just jump in at the last minute, it can be kind of confusing. I will say, if you have not done this before and you want to sit in an appointment and just kind of see how it goes and have that exposure, then I would say email the person. Some of these Senate groups are very large. My senator, I have 20 people scheduled for that. So that's a really big group to handle on Zoom. So I would suggest some of the other, some of the more remote area senators have smaller groups. So you may want to email that district lead and just say, hey, can I sit in? Can I just listen? I've never done this before. I would like to sit in and see how it goes. And so please, feel free to email that district lead and ask if you could just kind of be there. So let me,
Sherry, there's a couple, so people are doing a great job in the chat, and there's also a Q&A panel. I don't know if folks have seen, so we've got a couple of questions and statements in there. Let's see, Suzanne Jarvis said Senator Whitmire appointment is set for April 14th, and the constituents on the email list are contacting me that they can attend. And then Shirley Collins Clark said, I don't see Senator Boris Miles' appointment time in Zoom link. Do I need to resend the information?
that's already been answered, Jason. She was looking on the House list and not on the Senate list. It's on the
Okay.
Senate.
And then one other thing, this is from an anonymous attendee. Would it be acceptable to speak about the continuum of services after a client discharges from a rehab facility in regards to the importance of telehealth, telemedicine, technology-related bill, HB4, the importance of keeping the connection going on with the client for recovery services, and how important the bill is, especially during the era of COVID.
And Jason, I answered that earlier when I saw that I had that one question I was going to answer and didn't know how to respond, but we got it.
Got it. Sorry, I must be multitasking. I just want to make sure that everybody's Q&As were answered. Thanks.
And we will speak to that specific bill when we go over the bill reviews. Okay, so the appointment scheduling, and if you, okay, I'm going to get out of this. Jason, if you will go back to the PowerPoint, please. Sorry, back up. Okay, so with the appointments. Now, for those of you who don't have a representative appointment today, and as Suzanne Jarvis just let us know, she was able to schedule with Senator Whitmire, but not until April the 14th. So she is reaching out to that constituent group, and she is inviting those individuals to attend that appointment with her on that day. All the information that we talk about today will be relevant to that appointment on April the 14th. We have an appointment tomorrow with Senator Kolkhorst on April the 1st, because she could not meet with us today. So we have that for tomorrow. So for your representative, if you would like to reach out and make to continue to try to make an appointment with your representative, that is a great thing for you to do. And we will post a link to where you can have a template for an email to email and request your appointment. We have step-by-step process and how to call, get the information that you need, send the email, what to say in the email. And, after we go through all the bill information, hopefully you will have some bills that you would like to talk about, and you will feel a little bit more comfortable in initiating that appointment and calling them. And so this is not the end of this. And just because there wasn't an appointment scheduled for today, does not mean that is not something that you can follow up with. And so, we have 31 senators in Texas. We had constituents sign up for Recovery Day at the Capitol in 31 Senate districts. That is the first time that has ever happened. And we were so excited to have the opportunity to reach out to all of those senators. So is there, let's see. Okay, we had a break scheduled at this point. Do we want to carry on? I think we broke when we weren't expecting.
I think we can go ahead and continue to move forward.
Okay.
There's a couple of questions in chat I wanted to highlight real quick. So we got a question that says, what do we do with people who have registered but never received an email? Everyone who is registered should be receiving emails from us. There's about 400 of you, I believe, close to, on our email list. If you are not receiving our emails, I would recommend looking in your spam and trash folders. And if you are using an organizational email, we may be blocked from your IT department and not really able to do anything about that. So if those kinds of things are still happening, please let me know. I've been emailing all of this information from my actual work email. So hopefully, at least today, some of that stuff will be minimized as we move forward today. And also we got a question, would we provide the email addresses for representatives and senators? If you get on if you type in Google Texas Legislature Online, you will get to a website, and we'll hit on this later, but you can find every committee member's email, the clerks for those committees, and all of that stuff is located on that website. It can be a little daunting and it's massive, but there is so much information that can be found on those websites, and we will actually be touching on that later.
And Elizabeth, one of the things in the information that we have a step-by-step process that walks you through how to make those appointments. Those of you who were asked to make appointments already, you received that information in an email, and we tell you how to call the office, whose email you're asking for. So, you know, to send an email directly to your senator, it's going to get answered by a staff member anyway. And the thing that we have tried to do with our appointments is to target the staff member in the office who handles healthcare policy. As Amy mentioned earlier, the staff members are really your best friend. And that's the person that you want to build a relationship with. And so we're, you know, some of the people have experienced the frustration of trying to get an appointment scheduled with their senator or with their representative, when generally you can get a much quicker response if you focus on the healthcare policy person and then ask if the senator can join in that appointment. So we will send you information that gives you a step-by-step process of how to request those appointments.
And if you haven't received any information from your district lead, I encourage you to look on the spreadsheet that has all of the login information and appointment times on it. The district lead and their email is listed on that spreadsheet. So I'd really encourage you to contact them and work out any questions or logistics y'all might have directly with them.
So, and if you registered Monday or Tuesday, you probably didn't receive a lot of this information that we're talking about via emails, because at that point we just couldn't add all that stuff in.
Great. Thank you both for answering those. Are we ready to continue on about the bills?
Yes, and we start off with our favorite little bill.
Well,
and I will say this is a great little film. It speaks to Washington, D.C. Just think Austin in the process.
This is my favorite.
Doesn't seem to want to play. Let's see if I, what is it called? I'm just a bill.
There it is.
This is the checkers game where
Could y'all hear that volume?
Mm-hmm.
You could?
I could a moment ago. Now I can't.
and granddad will bond.
So.
Whew, you sure gotta climb a lot of steps to get to this here in Washington. Well, I wonder who that sad little scrap of paper is.
I'm just a bill, yes, I'm only a bill, and I'm sitting here on Capitol Hill. Well, it's a long, long journey to the capital city. It's a long, long wait while I'm sitting in committee, but I know I'll be a law someday. At least I hope and pray that I will, but today I am still just a bill.
Gee, Bill, you certainly have a lot of patience and courage.
Well, I got this far. When I started, I wasn't even a bill. I was just an idea. Some folks back home decided they wanted a law passed, so they called their local congressman, and he said, "You're right, there ought to be a law." Then he sat down and wrote me out and introduced me to Congress, and I became a bill. And I'll remain a bill until they decide to make me a law. I'm just a bill. Yes, I'm only a bill. And I got as far as Capitol Hill. Well, now I'm stuck in committee and I'll sit here and wait while a few key congressmen discuss and debate whether they should let me be alone. I hope and pray that they will. But today I am still just a bill.
Listen to those congressmen arguing. Is all that discussion and debate about you?
Yeah, I'm one of the lucky ones. Most bills never even get this far. I hope they decide to report on me favorably, otherwise I may die.
Die?
Yeah, die in committee. Oh, but it looks like I'm going to live. Now I go to the House of Representatives and they vote on me.
If they vote yes, what happens?
Then I go to the Senate and the whole thing starts all over again.
Oh, no.
Oh, yes. I'm just a bill. Yes, I'm only a bill. And if they vote for me on Capitol Hill, well, then I'm off to the White House where I'll wait in a line with a lot of other bills for the president to sign. And if he signs me, then I'll be alone. I hope and pray that he will. But today I am still just a bill.
You mean even if the whole Congress says you should be a law, the president can still say no?
Yes, that's called a veto. If the president vetoes me, I have to go back to Congress and they vote on me again. And by that time, you're so
By
old.
that time, it's very unlikely that you become a law. It's not easy to become a law, is it?
No, but how I hope and pray that I will. But today I am still just a bill. He signed your bill. Now you're a law. Oh, yes.
Great, thank you so much. We did have one question if we were going to be able to share the slides. I don't think that'll be a problem at all. So we can get those out after this session. And then I believe also, Elizabeth, that we're recording this session and we'll be sending it out due to our technical difficulties. And again, our sincere apologies to all of your colleagues on the capacity issue. We thought we had that taken care of. So we'll just keep going. So now we're going to actually talk about the bills that you need to cover. And I am going to go ahead and extend my apologies. At 9:45, I need to drop off this meeting, but I'm so excited to have so many people here. Everybody's going to have a great, amazing day. And I look forward to seeing the groups that I get to work with Senator Hinojosa and Senator Zaffarini later on today. So I will stick around for a few more minutes and turn it over to Cynthia to talk about prevention. And, oh no, I'm sorry, Sherry first. Did you have more to add, Sherry, or do I go to Cynthia?
I think Sherry, you're on mute.
Oh, you were just going to talk about dropping how to do the leave behinds. Still on mute.
Jason, will you pull up our talking point sheets? Thank
Are you able
you.
to see it there? Do I need to make it bigger?
If you can make it a little bit bigger, that would be good. We have 3 sheets. They are divided into prevention, treatment, and recovery topics. And we will go over these because this is where we're going to go over the bill. So we'll go over each one of these in detail now for the next, several minutes. But these will be the leave behinds that you will have for your appointments today. So if you are in, Jason, will you put this link in the chat box? And this will, and so our suggestion is either prior to your meeting, you email this link to the person that you're having your meeting with in the elected official's office, or you drop it in the chat box when you start your Zoom meeting with that elected officials or their staff member. And so this, you can and then you will have this kind of as a visual as you're talking. You can share screen. You can pull these up and share screen if you want to do it that way in your meeting. But this will give you the opportunity to have these talking points in front of you. They will see them. They will have them to refer back to because they want to know specific bill information. And so this will give them that specific bill information. Okay, Cynthia, I'll start with prevention. You're on mute.
Okay, so prevention, which is a good place to start because it's the beginning of the continuum care. So the state of Texas provides prevention services through the block grant. Most of these are provided free of cost to the schools, as well as organizations that have community coalitions that work to make environmental policies in their communities safer, and they implement kind of environmental policies, which many of you are familiar with, such as, driving under the influence, things like alcohol tax, things that are preventative to a community and individuals, policies that are preventative to communities and individuals from having substance abuse. But what we focused in on today, or this session for the bills, is on those programs that provide prevention services in the schools. HHSC funds a bunch of those programs. And the good news is that we hear a lot about evidence-based programs today. It's a familiar phrase. We often know what that is. And prevention programs, or substance abuse prevention as a field, was really an early adopter and was a motivating force to developing these evidence-based prevention practices. And the state of Texas funds only those that are registered or recognized as evidence-based. So what we are trying to promote is basically more utilization of these prevention practices in the schools, because as we've started to implement these programs, we found out that not only do these programs, which are based on risk and protective factors, prevent a child from using substances for the first time or escalating their substance use and to become a substance use disorder, that these also prevent a range of other behaviors such as bullying and teen pregnancy and other issues that are important to our youth and to legislators to try to prevent. So what we are trying to do in the two bills that we are asking their support for is in Senate Bill 2063. This bill actually focuses on school policies for kids that are getting in trouble because of actual substance use. As many of you are familiar, most of the schools' disciplinary practices focus on suspension, expulsion, alternative school placements. And so what HB 263 does is basically direct schools to develop policies about what they're going to do with kids who violate the school policy and show up under the influence or have an actual substance use disciplinary issue. And this will have schools basically start using what they call the alternative disciplinary or restorative disciplinary processes, meaning they get to services first. We try to get these kids help early on. And the Menendez bill will have make schools focus on that. The WU bill, HB 1201, is along the same lines, except for it's looking at actually for all disciplinary issues that schools begin to develop restorative practices instead of falling back on suspension, expulsion, alternative school placement every time that a kid has a violation of a school policy. Restorative disciplinary policies force the schools to kind of focus on, okay, what kind of help does the kid need first? It's the first line, not just immediately into punishment. So that also sets up an opportunity for those prevention programs. And that provide selective or indicated types of preventions are a perfect match for some of the levels in these restorative disciplinary policies that schools may be developing. And we support that. We want these kids to have access to care or access to services first, so they don't escalate in their substance use. And by putting these particular bills in the schools, or passing this bill, will tell schools they've got to start looking at this approach rather than the approach that they've been using for many, many years, which is punishment first. This kind of shifts into, we're going to look at how we can prevent and keep kids escalating if they're having disciplinary difficulties in school. And so that's what we're advocating for in terms of prevention.
Cynthia, there was a question in the chat. Can you define evidence-based programs?
Okay, evidence-based programs, very simple, is that there is a package of research that is focused on a defined program, be it a curriculum, be it some kind of manualized type of program. They've gone into the laboratory, the live laboratory, and tested to see if these kids, as a result of participating in their programs, or if it be an environmental program, say that if you have a policy against having parent-sponsored keg parties, that it will actually reduce the incidence of drinking. So it's actually been proven in the laboratory that it is effective. We're not just guessing, or it sounds like a good idea. It actually has some documented research that is effective.
There's also a question, are there any funds dedicated to these prevention bills?
Well, I don't believe at this point in time, I don't want to get real confusing. The bills often have what they call a fiscal note assigned to them. And that means that if the legislature passes this particular piece of legislation, it will cost the state this much money, and it is estimated by the Legislative Budget Board. At this point in time, these have not developed what they call a fiscal note. So I'm going to assume that basically within either the sources of public education funding now, or via the funding through the Health and Human Services, who is the one who actually funds the prevention SUD programs, that they can pass the policies without costing money. But in terms of actually bringing in the programming, that will be an assessment done by the Legislative Budget Board, and they will determine whether it will cost more money or not. And so at some point in the process, especially if they're getting ready to be heard, a bill's getting heard in committee, they will assign it a fiscal note. And then when the fiscal note is assigned, then you'll go in and see how much that would cost. But we want these policies and the funding to go with it if a fiscal policy is, a fiscal note is attached to the bill.
Awesome. And there was one more question. Can we discuss House bills in the meeting with our state senator? So it's, talking about, are House bills only for the House and Senate bills only for the Senate? Or do we just talk, do we talk about bills in both chambers?
Well,
Sure.
I think in this situation, as we had our little I'm just a bill fellow, it illustrated that every bill that starts in the House will ultimately end up in the Senate if it doesn't have a Senate, what's called a Senate companion. And so then it will transfer over to the Senate. So we can identify that this is an important House bill, but introduce it with the caveat that you understand this is a House bill and not a Senate bill, but you just want them to be on the lookout for it when it comes over from the House. But in this situation, this is a great opportunity here because we have a Senate bill relative to prevention and we have a House bill relative to prevention. And since we want you to only select 3 or 4 bills out of all of the bills that we're going to give you in the Senate, on your Senate appointment, it might be prudent just to pull the Senate bill off of this list. So,
And Chrissy, if you're meeting with your senator and discussing a particular House bill, and if we've not told you today, it may not have that Senate companion. You can always tell your senator, I would, it would be great if you would sponsor the companion bill. So if it's something that you think is important, that's an ask that you can have for that office, and vice versa. If you're talking about a Senate bill and we've not listed, there's the House companion, and you're talking to your House representative, then that could be an ask. If it'd be great if you would sponsor the House version of this Senate bill.
Cynthia, would you go ahead and talk about preserving funding?
Sure. So one of the interests for, our three organizations is for people who aren't insured and, meet certain financial qualifications. We want them to have access to substance use disorder services as well. And so funding becomes an underpinning for the whole continuum across the state, so that we have services for individuals who don't have insurance or aren't financially able to afford to go to treatment. And also prevention services are predominantly offered to the state through public programs. And of course, in recovery support services, we need to get more of that to support programs. This has been, because of COVID, a very difficult year for the state budget. It's a lot better since we've gotten a lot of COVID relief funds coming into the state. But back in June, we were looking at a $4.6 million deficit in our budget, and the revenue for our budget to support our budget for the state. It's a little bit better now when the comptroller announced how much we'll have available to spend this year. And it's only about a $1.6 billion deficit. So it's better, but it's still a very, very difficult session for the state budget. The way the budget kind of falls out is state agencies basically put in, this is the budget I'd like you to fund. And so the majority of these public, and I hate to use the phrase, non-behind bars programs, but the community-based programs that indigent Texans can access come through the Health and Human Service, the Department, HHSC, the Health and Human Services Commission. There's all some version of Health and Human Services, and they're funded primarily through the Substance Abuse and Treatment Block Grant. So a lot of the funds are federal and specific to substance use disorders, but a portion, and it's growing larger because we've had some budget increases, but a portion of those funds come from what we call general revenue. And that means your taxpayer dollars that come into the state, and the legislature designates where they go and what they're going to fund. So we have a small portion of our substance abuse funding, about 22%, that does come from general revenue. And this year, as we looked at this difficult budget time, we were hoping to kind of hold harmless. We were hoping to maintain our funding levels and not suffer a cut in any area for substance abuse services. But unfortunately, as we've been talking about, there's Senate versions of bills and there's House versions of bills. The Senate puts in its version of the budget, and the House puts in its version of the budget. When those two versions came out, the Senate bill basically said we want to cut $20 million from the treatment side of things. And we don't want that. Obviously, we struggle for every dime. This was new money that came in last session, and the Senate basically has proposed to cut that. The House does not. The House version of the budget says we're going to keep the funding, the overall funding for substance abuse services level. Because funding is important to all facets of the service continuum, prevention, treatment, and recovery support services. We have a specific ask as we go into both House and Senate versions, is that we would like you to support the House version of the budget, which is HB1. The Senate version is SB1, because it is the only thing that a legislature must pass every session is a budget. So it always gets the House Bill 1 and Senate Bill 1. And so it's appropriate to say at this point in the process to support the House version, which does not cut substance abuse services. Under this, preserve funding it's not really the right place for the bill. And unfortunately, Amy has left because this came to our attention, is a bill, SB 2013, which is not strictly it really isn't a funding bill, but we put it there because we don't have any room on the treatment page. SB 2013 is a bill. If you get a license in Texas as a treatment facility, you go in, you get audits, you maybe have your complaints inspected. There is a penalty schedule, if you will, for different levels of offenses or findings in those audits and inspections. For a long time, there was a schedule of different levels of funding attached to different levels of findings. And those were realistic. They were assessed according to what the realistic I guess what viability, I don't know what the word, some business person can say that, on how much they can afford for the industry. Such as nursing home industries aren't generally known as, high profit makers, either are substance use disorder services. But recently there's been a very high level of penalty assigned to those infractions, and we are trying to bring those back to levels that the industry can afford. And so this bill basically says, let's study what's going on currently. Let's determine the penalties. Let's post the penalties, because right now it's not clear what they are, how much you're willing to pay, and how much you have to pay. And we would like it to be more transparent.
Cynthia, we've gotten a couple of questions, and I'm going to try to summarize them. So if I don't get this right, people definitely let me know. The questions around the COVID money, Congress passed, the COVID funds, they'll be coming to Texas. And I think there were some questions about, how does that impact, or is it going to be directed in specific ways? Should they be talking about those funds?
I would say there's a lot of money coming in. We're in the process really trying to figure out what that is and what the amounts are and when they'll be arriving. There's money from what they call, when we passed the federal funding bill, there was something called the COVID supplemental funding, and we got some supplemental dollars in this year's block grant. And then we have the dollars that will be incoming to the state from the rescue funds. These are one-time dollars. They're not reoccurring, so they will support kind of one-time projects. We don't know how much creativity that you'll be able to use, but for our purposes today, we're looking at the state budget as it appears in HB1 and SB1. That budget does not incorporate any of those dollars. And so we want to make sure as we go through the state funding that the state starts to devote and pay more attention to providing services for substance use disorder, basically, and not to rely on federal funding totally. I'm not going to get real complicated with maintenance of effort and all this other kind of policy attachments, but once COVID goes away, all those dollars go away, and none of the services or projects that were funded by those will continue. So we're very concerned that this base budget maintains, at least this year during COVID, maintains level funding.
I believe there's a follow-up question that says, who makes the decisions on how those dollars are spent? And I'm assuming those dollars, again, are referring to those federal COVID dollars that are coming down.
The answer to that is we don't know. What will happen is the feds will send a grant letter basically to the state Health and Human Service Commission, and it will have certain funding directions, what you can fund, what you can't fund. And it will be directed at COVID. It won't be directed at substance use disorders. It will kind of be directed at COVID as it impacts substance use disorders. Ultimately, it will be HHSC that will make a determination about where those funds and what projects those funds will be supporting. And they're in the process of kind of looking at that right now. But as of my last inquiry, and that may have changed, the state had not received its letter, even from the feds yet, with the amount and the directions for funding. So that's the starting.
So if I'm hearing you right and kind of putting in context of today. So today is Recovery Day at the Capitol, and we're focused on the bills that are in play at the state legislature. And so while the COVID dollars are really important, that's really kind of out of the scope of today's conversations, or the conversations that they should be having with their state representative and state senator.
Right. We're looking at the bills that are in play right now, and that's HB1 and SB1. And the COVID dollars are not involved in that. So to kind of go in that territory, they don't know. So we're just going to have to wait.
And everyone, I dropped the link in again. So if you're interested in downloading the document that we're talking to and sharing that with your representatives or senators, I've put it in the chat box. I'll continue to do that, and you may want to go ahead and download that and make sure that you can and have that on the ready for your appointments later on today.
I did notice a typo on our sheet here. It's actually at the header says HB2 and SB1. They're on the appropriations bills.
Oh.
And so we will get that corrected shortly here. And I also, advocacy is more than just at the Capitol, and we do a lot of advocacy, and ASAP specifically does a lot of advocacy with regulatory agency, with HHSC. And so that is one, leadership of ASAP has monthly meetings with HHSC leadership. These kinds of ongoing issues that happen outside of the legislative session is one of the things that ASAP really works on. And so its member organizations have the benefit of being involved in those conversations and the benefit of having kind of some firsthand knowledge to what goes on with that. And so if you work for a substance use prevention organization that provides prevention, treatment, and or recovery services, ASAP is an organization that you may very well want to look at being a part of. Before I jump into the treatment bills, I do want to acknowledge Lori Rowe. She wasn't able to be with us when we started first off this morning, but Lori, wave your hand. Lori is our legislative chair for TAP, and she's been very involved with the planning of Capitol Day and has worked really hard, has helped some folks with their appointments, and has gotten, has helped us to get all this stuff off the ground. So Jason, you want to continue scrolling so we can see the treatment page? Is there anything else we needed to add, Elizabeth or Jason, Cynthia, Lori, before we move on to the treatment page? Okay. These are bills relative to various things that impact treatment services. Definitely appropriations would impact treatment services. The bill that Cynthia talked about in terms of the fines that HHSC can put on an agency is something that affects the financial status of treatment providers. That is specific to licensed chemical dependency programs. So these are some, these address treatment services from a variety of different areas. And if you'll scroll just a little bit more, Jason, HB 297 was filed by Representative Murr. It is currently in the Public Health Committee. When we have a committee here, that means that it has actually been assigned to that committee. And someone asked in the chat or the question earlier about Senate Bill 2063, and if it was assigned to a committee, what committee would it be assigned to? That was one of the prevention bills, and that has already been assigned to the Senate Public Education Committee. Okay, HB 297 has to do with the annual training that employees in licensed substance use treatment programs have to take every year around patient rights, abuse, neglect, exploitation, illegal, unprofessional, and unethical conduct. This was originally established by statute in 13 legislative sessions ago, actually 14 legislative sessions ago, so about 28 years ago. And this maintains the initial 8-hour training requirement, but it reduces the annual requirement to 4 hours rather than 8. The reason that we want to do this is this applies to every employee of a treatment program, and it's a tremendous amount of staff time that's spent in redundant training. So a thorough training at the beginning of someone's employment in these topics is critical to protecting patients, and ongoing update information is critical to protecting patients. But to continue to have the same requirement for redundant training year after year after year is not the best use of staff time, and allows us to give that time back to patient care. Also, if they say, well, how do patients get protected? Facilities have multiple mechanisms in place to protect patients, and those are required either through licensing statutes or accreditation standards. So every facility is required to have a patient rights representative. Every facility is required to have internal reporting of any kind of incidents that relate to patient abuse or neglect, unethical conduct. There's internal reporting that has to be done, and then there's a number of areas that are required to be reported within 24 hours to regulatory agencies, and even some are required to be reported to accrediting agencies, as well as every patient is informed of their rights at the time of admission and given the contact information for who they would go to both within the facility and within the regulatory agency should they want to file a complaint feeling that their rights have been violated. So this training is not the only piece that protects patient rights. There's a number of mechanisms in place that do that. So that's HB 297, and it's currently been assigned to committee. That will give our facilities a good bit of staff time back in order to devote to patient care. And then SB 171 by Senator Blanco. This is a broad application to healthcare in that this is calling for a report regarding Medicaid reimbursement rates and how that impacts the access to care. And we have asked for language to be added to this bill that would specifically highlight mental health and substance use disorder Medicaid rates. And what we know is that those rates are incredibly low, and that is a disincentive for providers to operate within the Medicaid system. So for those individuals whose healthcare is provided through Medicaid, they have that limits their access to substance use treatment services, as well as mental health services and recovery services. And so being able to look at Medicaid rates, compare those to what would be a more equitable rate in terms of the cost of care would help healthcare overall, but it would also help those who are in need of substance use disorder services to expand those networks if the rates were more palatable to providers. HB 2595 was filed by Representative Price. It is currently in the Insurance Committee, and this is another follow-up law to strengthening our parity enforcement in the state of Texas. Parity is a federal law that dates back to 2008, and we've had follow-up federal laws as well as follow-up state laws. But what parity says in general is that if your insurance benefit provides mental health or substance use disorder treatment services, it must provide it at parity or no less stringent than medical and surgical benefits. So whatever your deductible is for medical surgical, it can't be any different for behavioral health. Whatever your maximum coverage is for medical surgical, it can't be any less for behavioral health. So the mental health and substance use have to be treated as any other medical or surgical illness or condition. So this specific law relates to development of educational materials and parity law training. So this would increase consumer rights under parity law. So most people don't even know that parity laws exist. They also have no idea how to file a complaint should they need to file a complaint or try to get some kind of resolve. So this would establish complaint portals. It would simplify the process. And there also would increase education for consumers as well as health benefit employees. So oftentimes it's the employee of the insurance company that is reporting, well, I'm sorry, but you have a one-time lifetime treatment max for substance use disorder, or you have, we will only authorize your care for 3 days at a time, whereas no such limit exists on the medical surgical side. So insurance company employees sometimes are reporting that information, having no idea that that is a parity law violation. So this would require in education for health benefit employees. And then if you'll continue to scroll just a little bit, Jason. House Bill 3331 by Representative Murr has currently been assigned to the Public Health Committee. And back in 1993, Texas passed 2 laws that were established to stop patient brokering and patient solicitation. And this was in the late 80s and the early 1990s. This was a huge problem in the mental health and substance use treatment industry in Texas. And if you have heard all the national reports about patient brokering, paying for patients, sending patients off to faraway lands, so to speak, for treatment, for some kind of compensation happening in Florida, or sometimes we've heard about it in California. Those things were very, very common in Texas back in the late 1980s, in the early 1990s. We passed 2 pieces of legislation then. And so we've had this law in existence in Texas for a long time, but because it's old, it's kind of gotten pushed to the back burner. People have forgotten about it. There's a lot of new entrants into the market, some from these other states where this is not against the law. And so they believe they can do this in Texas too. So we've had a lot of reports of, some examples are freestanding emergency departments that pay for a referral for a patient if that person comes in and spends a 23-hour detox in their facility. Outpatient programs who are paying rent for individuals in recovery homes if they refer them to that outpatient program. Individuals who are paying cash for referrals to individuals, and there's no and so they're referring to a favored organization rather than considering the best need of the patient, because they're looking at who's going to pay me a referral fee, or compensate me in some kind of way. So this this is not new legislation. This is updating and strengthening existing legislation that has been overlooked for a number of years and brings it back into the limelight. And this specific additions to this legislation will create a task force to make recommendations for prevention of this activity, and requires a written report to come back to the legislators about the prevalence of this problem, and puts in some enforcement mechanisms. The previous law really didn't have much teeth in it in terms of enforcement. And so this actually puts some enforcement mechanisms in place and stronger penalties, and clearly defines what solicitation, deceptive marketing practices, and kickback activities looks like. And then the final bill on this is HB 4, which was filed by Representative Price. And this is a good example of one having a companion bill. Senate Bill 412 was filed by Senator Buckingham. This is currently in the House Public Health Committee. And this relates to the questions that have come up about telemedicine. This telemedicine became the norm during COVID, and substance use disorder treatment programs were basically prohibited pre-COVID to providing telehealth services. And people scrambled and put together virtual services, both in prevention practices as well as outpatient treatment practices. And there was that happened under the emergency orders that Governor Abbott put in place during COVID. And so there's a big push in HB 4, and the low number shows the priority of this. It's number 4. It's one of the very first bills that was filed. There is a big push to make the telehealth and the telemedicine services that became available under COVID emergency declarations as a permanent service. So it's not just for substance use providers. It's not just for mental health. It is for medical services as well, but it does cover us. So we've seen the opportunities. We've seen the reach into rural areas that did not have access to services that telehealth can provide. And we support this effort to make these provisions permanent in Texas. So, and someone asked about, can they, is it appropriate to talk about the continuum of care that's available? And so, yes, it's, in what we've talked about with this, you won't talk about all of these bills. You'll pull 3 to 4, your group will pull 3 to 4 that speak to, and each one of those should speak to the person who's going to talk about that. And if you have something, a specific example, if your organization is a Medicaid provider and you have information about how difficult it is to provide quality services at Medicaid rates, then that may be a bill that you want to pull out and talk about. If you have seen great opportunities for clients because of telehealth services being available, that may be a bill that you want to talk about. If you're an administrator in a treatment organization and you see a ton of staff time, I calculated the patient rights training, the abuse, neglect, and exploitation training. I calculated that for our organization. And this reduction of 4 hours, we have 180 employees. This reduction of 4 hours would give us back 18 weeks of staff time. So one individual for 18 weeks would be given back to us in the 4 hours that we would save if this bill passes for each of our employees. So it's there are ways for you to personalize this information and make it fit with your experience and how you see the benefit or the need for this. So pull out those things that speak to you and attach to them why it matters in the district, why it matters in your organization, why it matters to you as an individual. Any questions on any of these?
Carrie, I just wanted to add that actually when you watch the bills go through the process in our little video, HB4 is being heard in committee today. ASAP has some testimony. One of our legislative chair is providing testimony and is sitting in that committee room now. So if you're kind of interested in watching that practice go on, because that's another way, aside from visiting with your legislator, you can support a bill is by providing testimony. There are certain ways to provide it during COVID, but I just wanted to highlight that in case anyone's interested in kind of watching those proceedings, those hearing proceedings take place.
Thank you, Cynthia. Any other questions on any of these bills? I don't know if my chat froze or I'm not seeing anything.
There is a question Claudette asked, is HB 3331 the same as what was listed as HB 1161?
HB 1161 was kind of our start to address this issue. HB 3331 is a much stronger version of that. And so we are replacing HB 3331 for our focal point. So if you have documents that say HB 1161, that these have been these documents have been updated. Also, the last bill that Cynthia talked about on the prevention page with the fees for violations, that has been updated as well. So if you don't have the most recent version of these, please download the most recent.
Definitely want to give a shout out to Sherry for picking up on the typo earlier, and also a shout out to Elizabeth for correcting that. And the updated version of the leave behind summary is in the Google Drive, and I've just shared that link. So if you would download the previous version, you can download this one, and it would fix that typo. We're real time, folks.
So we've got one more set of bills to go over. I think Elizabeth, you're up for the recovery bills.
Yeah, so on the note of the updated documents, I also wanted to let y'all know that as soon as this meeting is over, I will send an email out to everyone that has the PDFs as attachments and the link to the spreadsheet with all the appointment information on it. So if your email is getting blown up today, I apologize, but there's only one more blow up that's going to happen from me, hopefully. But what I'm getting some feedback from a few people that their organization isn't allowing them on the Google Drive. So that's why I'm going to download them and send them to y'all. So if you can't access them right now, it's all good. You will have them shortly. So because we work in real time here during the legislative session, I am super excited to let y'all know that House Bill 544 has been sent to the House Calendars Committee to be heard by the full House. So that's great. The committee substitute was submitted at the end of last week. And this is my first bill, y'all. So I'm super excited. I'm probably going to go around the block when we're done.
Elizabeth, HB 745 passed out of committee too.
Awesome. And HB 707. So we're just a bill passing group today, which is just super. I'm so excited. Oh my God. Okay.
And so I'm shout out to Elizabeth because she has been the driving force behind these bills, the 544 and 707. She has been the driving force behind these bills. And you talk about working a bill. We say working a bill. She has worked a bill.
Squeaky wheel, y'all. Squeaky wheel. So House Bill 544 is no longer pending in committee. It is set to be heard on the House floor. Hopefully it will get a date soon. There is it is regarding voluntary recovery housing certification with referral and refunding and funding requirements. There is a similar bill, and it is House Bill 292 by Representative Murr, that does not have the referral and funding requirements on it. So again, 544 just got sent out of committee and hopefully will be heard on the House floor soon, and then will be passed along to the Senate. What 544 does is it defines recovery housing in statute. Some of us may think that has already been done by now, but believe it or not so much. It also does a couple of other things. It helps give Health and Human Services some real clear direction on how to go about having voluntary certification in Texas. So it directs them to appoint one or more certifying agencies. It also requests that all recovery residents have a certified administrator. And there's been a little bit of confusion around what this means. A recovery house administrator is not a house manager necessarily. Recovery housing administrators typically are the ones that are going to have the insurance, the owner operators, if you will. They will file the application for certification and manage the more administrative duties of the house. Whereas a recovery house manager lives in the house and has more of a peer-based role with the rest of the family of residents that lives in the recovery house. Also, House Bill 544 will greatly invest in training and technical assistance for recovery homes across the state of Texas. And this is something that is so needed. A lot of questions that we get, there's a common theme to a lot of the questions that we have. And I would like to say, as a person in recovery, that does not mean I know how to run a business. And so making sure that things are set up in a positively impactful way in the house, and that not only align with best practices, but that also are legal. Because although we may have the best intentions, sometimes we end up breaking the law even with our best intentions. And so it's really meant to elevate and solidify practice, right? So I see there was a question about Oxford House. This bill, from what we understand, the only effect that it will have on Oxford House is that they will be grandfathered in, or a concession will be made to acknowledge them the same as you would a certified recovery home. So at the end of the day, that is left up to Health and Human Services as to how they want to incorporate that. But that's what our conversations around Oxford House have been with Health and Human Services. And other states, 26 of them across the US, have recovery housing certification with incentives, which is the referral and funding requirements. And they have a variety of different ways that they have worked with Oxford houses. And one of the ways they do that is either to recognize their charter or make other concessions in their rulemaking for Oxford House. So it's absolutely not uncommon to do that. Another thing that this bill does, Sherry mentioned earlier about patient brokering and kickbacks and deceptive marketing. This also touches on that as well. I know, intentional or not, sometimes with our language, we can cross into clinical language and using some other terminology that in a peer-run environment may not actually be the best description of what we're doing. So it's addressing some things like that. And again, providing that training and technical assistance to the recovery home to really engage in best practices around that. And so about the restrictions, I get a lot of questions about these. All right, so in order for a recovery home to receive any state funding or a referral from a licensed professional, and that includes counselors, licensed facilities, all the things that fall under that, they would need to be certified. And that at the end of the day, the money that gets kicked out to the state that these facilities use, that's still state funding. So it's really meant to incentivize homes to become certified and adhere to these national best practices. All right, now House Bill 707 is all about the data. So we need to know more about recovery housing in Texas. It's kind of the Wild West in some ways, where we have some different organizations across the state, Recovery People being one of them, that has done some environmental scans to get an idea of how many recovery homes there are, what kind of homes they are, who they serve, where they're located, and some information like that. But everyone's information is just a little bit different. And so to really be able to understand the impact in the state of recovery housing in Texas, doing a study so that we know how to implement and so we know how to expand recovery housing in rural and urban areas is really important. And one size doesn't fit all. So what happens in Dallas and works in Dallas is not going to work in Bernie, right? So we need to be able to make concessions for what all these different areas of Texas would need. And that's what Moody's House Bill 707 does. It really starts to look at the impact of regulations, state and federal deficiencies and where those might be so that we can start to address these things in a much more significant manner. So it really could be very important and have a significant impact on how we operate in Texas. And then finally, Jason, if you can scroll down just a little bit, there is House Bill 898 by Representative White that has also been assigned to the Public Health Committee. And what that is doing, this one's pretty straightforward. But I love bills that are only like a page and a half and written in regular English. So what this bill does is it creates a definition of a community recovery organization. And a community recovery organization would include peer and family governed entities and would focus on mental health and substance use, peer programs, and best practices. So it's bringing SUD and mental health, peer and family programs under the same terminology umbrella. It does not make mental health and SUD peer programs merge into one thing. So mental health and SUD still get to keep their identities and still get to do what they do best. But what it does is it builds a little bit of a bridge so that we can have our own lane, if you will, as mental health and SUD peer and family programs. So it will direct Health and Human Services and other state agencies that come along to identify some funding sources that may be able to be targeted or geared towards community recovery organizations. And it also sets in a set of criteria so that these agencies know what to do with this funding and who would be eligible for it should it and when it becomes available. Sometimes we can get a little skewed in where we think funding should go. Agencies can get a little conflicted or I think better wise, just not really have a clear picture of where some sort of funding can go. So it falls on us as a community to help them with that. But part of what the Community Recovery Organization bill does is helps clarify to them where that can go and what it needs to be applied to. A couple of other really cool things about this bill. I really feel like this elevates peer and family governed programs on mental health and SUD side across Texas because it requires partial governance by those peers and affected family members. It's 51% governance by peers and affected family members. And that is significant. Nothing about us without us. And so to have that type of an influence on organizations like this is really great and definitely a move in the right direction, in my opinion. And again, this will align all of these practices with national best practices. And many of these peer programs already are in alignment with best practice. So it really highlights some of the important work that's already being done and helps expand that work as well. That has not been assigned for a hearing yet. Fingers crossed that it does get assigned soon, but we're really looking forward to seeing where all of these bills that we've talked about today end up going during this unprecedented time in our legislative session. But if y'all have any questions, please let me know.
There's a question in the chat. Suzanne had one. Do RCOs fall within the CRO designation?
Yes, absolutely. 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 They are most certainly included in the CRO designation, as well as COSP programs, clubhouses. So it's pretty inclusive of those peer and family programs, but it most certainly includes recovery community organizations as well.
Lakeisha had a broader question. Where are the criminal justice and reentry bills, or how can she locate them? Yeah, we'll start there, and then there's another question too. But anybody want to take that question? Where are the criminal justice or reentry bills, or how would one find those bills?
So one of my recommendations would be if there are certain topics. So first off, there's a whole lot of SUD bills that are happening right now, and we only are touching the surface with this. There's a whole lot in very little time. So the criminal justice bills, if there are things that you are particularly interested in wanting to follow, getting on the Texas Legislature online website and doing some word searches with that would be one of the places I would recommend starting. Also, the Texas Criminal Justice Coalition and Grassroots, there's some different coalitions in the state that are also working on criminal justice and reentry. And I think Cynthia might have a little bit more information on how to locate some of those bills.
Well, there's another way that you can kind of look for bills of interest that are kind of moving along in the process. And that is to see which committees are being, or which bills are being heard in committee. That's one way that you can check by going into Texas Legislature Online. And there's a place where it'll have House, drop down for House and a drop down for Senate, and a thing that's called committee hearings. You can click on that and you can, pull up the committee hearings. I use the committee hearings by date and look for when the, what they call CRIMJUR, the Criminal Jurisprudence Committee and Corrections Committee on the House side, and the Criminal Justice Committee on the Senate side is one way to, locate bills that are actually moving through the process. There are several diversion bills. There's bills about, they're all basically diversion bills or lessening the penalty for possession. Not necessarily full legalization, but just kind of how they handle the community correction side of things, as well as some of the in-prison side of things. I do have a list of some of those bills, but not all of those bills. It is, it's a different kind of area, although many of our organizations that are members of ASAP do provide services that are funded through the criminal justice. And I can make those available if people are interested in the ones that we have on our track.
And I just wanted to add to that, in case the question is, and why aren't these bills here today? This is a divide and conquer process to get all of the substance use related bills addressed and advocated for, intended to. And so there's a whole nother group. In fact, I was in a town hall meeting a couple of weeks ago where a lot of criminal justice and reentry bills were specifically discussed from the standpoint of carrying these forward in advocacy and giving people the information that they needed and basically the charge to do that. And so there's these bills. There's a few bills here that overlap: the Community Recovery Organization bill, the housing bill. But for the most part, our three organizations are the ones who are carrying these bills forward, whereas there's other organizations that are carrying other substance use related bills forward, and perhaps in the prevention arena, perhaps in the criminal justice arena. And we all support those, and we all work together to make sure that they all get covered. It's just we had to funnel down all of the bills that were out there relative to substance use disorder and say, okay, we're going to take these on. You guys are taking those on. You people are taking those on. So, that's why our focus is on these bills today.
And Sherry, thank you for that description. That's true. There's also a lot of opioid and harm reduction related bills that have specific coalitions that we work with. But these were the bills that we are considered, quote unquote, the lead on. And we work with those other organizations to support these bills, and the bills that other organizations are leading on, we work closely with them to support those bills as well.
Definitely takes a village, you guys. So one of the questions that was in the chat that I wanted to hit on is, would the Recovery Housing Certification Agency be an outside organization or within Health and Human Services? And it would be an outside organization that is contracted or that is working with Health and Human Services. So Health and Human Services would not be directly certifying recovery homes. It would be an external organization.
So we do have a question in the Q&A. Will there be opiate bills, medication-assisted treatment, MAT services, bills that are talking about those type of topics?
about opiates and some of the safe practices for opiate prescribing. There's
Yeah, I think just in general, her question is around, are there bills specific to the opiate epidemic or medication assisted treatment services?
Yes, predominantly the bills right now are some of the safe prescribing practices, code prescribing. So if you're prescribed an opioid, you're also prescribed Narcan. There's a Good Samaritan piece of legislation that is happening or is being filed too. So the opioid, there's not anything directly related to MAT in particular, directed toward MAT treatment, but there are some associated bills with the opioid epidemic that are filed, and we are watching and helping the harm coalitions support those. Did I answer that? I don't know if I was real clear on the question.
Yes, she responded. Thank you for answering my question. And we can definitely, as we talk, our groups work with these other coalitions. We can definitely reach out to them and get, copies of the briefs that they put together. I'm sure they'd be excited to hear that people are interested in the issues that they're the lead on.
Yeah, and one other way I might describe that is if they're the lead on it, they're holding days like today with their membership to kind of push those bills forward and do all that they can to what we call work the bill, and then we are there to show up and support or provide expertise. So those things are going on in their coalitions, and we are supporting them. They want us to kind of do that kind of work on these bills, and so that's how we cooperate together.
Are there any other questions? I've really appreciated the quality of the questions. These are great questions. If you have any other questions, feel free to drop them in the chat. So there was a question around, do we know which bills regarding Good Samaritan? And what about funds to cover MAT? Are there any new funds to cover these treatment options?
It is likely that when some of the COVID related one-time funding dollars, some will come down to help address MAT. But we still are we have some federal funds that come down from opioid specific federal legislation that are funneled through HHSC, and those are being upheld, but there's no new dollars past the dollars that came in on the state opioid grants, but those are being maintained right now by the federal government. And the emergency funds related to COVID will likely have some emphasis on the opioid epidemic and medication assisted treatment. So the answer to that is I don't know yet, still yet to be seen. We're not clear, but there's probably some dollars, I would guess, through these COVID emergency dollars that will go to MAT. Oh, Good Samaritan. There's several bills related to Good Sam that have been filed. One by, I don't have my bill track handy. I haven't committed those numbers to memory. Right. So we're kind of working to kind of get the best version of that bill out there, which means working with an author to try to get some pieces modified in the bill. And so we can give you that bill or give you that bill number. But at this point, while we're kind of trying to modify it and get the best version, it's what we're asking for is all right, bottom line is in the Good Sam bill, which is really not a true Good Sam bill, it's a defense to prosecution bill. they've added a limitation, which means there are several different limitations or disqualifications for a defense to prosecution to apply. And one of those they put in the bill is you can't have a criminal conviction, which, if you're trying to promote folks to, take public health action if someone's having an overdose and they're using with someone, that is very likely that they may have a criminal history, and then it wouldn't apply. So we certainly support a Good Sam legislation. It's not the best version of the legislation that could possibly be, but it does move us down the road. We're just trying to get that one change in the bill. And who's heading this up is the Harm Reduction Coalition that we work with. And, we're hoping to get that version of the bill out there. Our big trick for the 4 sessions we've been trying to do it is try to get it past the governor. So, these are kind of the issues that are involved in working a bill. And so, as Sherry said, we're going to leave kind of the machinery of how that works to that Harm Coalition at this point in time, and then support them and show up and do what they ask us to do when that bill's ready.
And Suzanne offered some bills up. I'm assuming that is in relation. So HB 1694 and SB 811. So you may want to look those up to see if that aligns. We do have a question. I'm wondering if SB 171 will address reimbursement to peer support services.
As for 171.
Yeah, I'm not familiar with that. I'll have to look that bill up.
And that's another thing that I would say each session a bill's going to pass that we find out about after the fact, because hidden in a lot of legislation may be, something that applies to us. And so there's a lot, 3,000, almost 600 bills are filed on average each session. So trying to wade through every single bill that may have a substance abuse inside of it is difficult to do. But we usually catch most of them, but there's always one that seems to slip through.
So SB 171 is filed by Blanco, and it's regarding a report regarding Medicaid reimbursement rates and access to care. So without going into the bill, it sounds like it's just requesting an interim report. And so if that's true, during that reporting process would be an excellent opportunity to raise questions around the reimbursement rate of peer services. Any other questions folks have about, bills or the process or, next steps for today?
We got to go over a sample agenda.
Oh, okay.
And
So,
we have a few more things to cover, and we have people that have 11 o'clock appointments. So you probably want to move. Okay, some of you have appointments at 11. A couple of people have already had appointments this morning. But some of you your appointment may be at 2 o'clock this afternoon. So some things that you can do just to get ready, to feel a little bit more comfortable: study the bill information. If your group is able to get on the Zoom call 15 minutes early or so, and you can connect to that constituent group, and y'all can talk a little bit about who will talk about what. You have a district lead who set up the appointment. The idea would be that individual would, thank the person for meeting, for their time. You would have a very brief, very brief conversation, very brief introduction, not getting into no resumes. We're not looking for resumes. We're not looking for organizational descriptions, just who you are. Remember, you've got maybe 15 minutes. And so the focus is the bill information and not your own personal background. If you have time, look at their committee assignments, see what might be of interest to them. And please be on time and be prepared. It's very disruptive when people start popping into a Zoom meeting late and you've already handled introductions, and now here's this extra, couple of extra people. So please be on time. Go ahead, Jason. And then for following up after your appointments, and this is a key, we've talked about this, you want to build a relationship. You're going to walk away from this, ask the individual that you meet with to put their name and their email address in the chat box so everybody in the group will have it. And then each person, send a thank you email to that person, thanking them for the time that you spent. You may want to reiterate your interest in a particular bill. You may want to offer to be a resource for them if they need additional information on a particular topic. If they've asked any questions and you need to follow up and get that information back to them, please make sure that you do that. You want to show that you are not only their expert, but you're a dependable resource for them. And then keep track of bill movements and stay in touch about bill progress. If you Google Texas Legislature online, there is, you can click directly into Texas Legislature online, and this little, I don't know if y'all are seeing me move my hand around because maybe you're not seeing my screen, you're seeing Jason's, but my TLO stands for My Texas Legislature Online. You can set up your own account and it tells you how to do that, and you can create a custom list of bills, and then you will get alerts on whatever is happening. So like the bills that were heard in committee today, the bills that were voted out of committee today, all of that stuff, you would get an email alert on. So if you had a House bill and now you see it has moved over to the Senate, then, alert the senator and say, hey, we talked about, this issue, House Bill so-and-so has moved to the Senate. Will you please keep an eye out for it and support that bill? And then sign up for the senator and House members' email lists. And you find out in that, again, things that are important to them. They love to toot their own horns. That's politics. But then also to visit their district office and introduce yourself to the staff. Some of you reached out to the district office when you couldn't get responses from the Capitol office about appointment times. That's great resource utilization. And so go by the district office, introduce yourself to the staff. I have a relationship with our representative's district director, and she's really helpful to me at times. And then, when your representative is out of session, they'll be back in your district and they'll be talking about session. They'll be talking about the bills that they passed. They'll be complaining about some bills that have passed, perhaps. Go to some of those town hall meetings that they have. It's an opportunity to see them, let them see you, continue to build that relationship. And then after session is over, because they don't do anything during session but try to survive the crazy schedule. After session is over, reach out and invite them to visit your facility, invite them to visit something that your organization is doing, and continuing to build that relationship. And don't forget the staffer. Continue to build that relationship with the staffer. When session is over, things get much more relaxed. People are much easier to get hold of. Once we get past this COVID stuff, you can drop by the Capitol, and you can, you may want to, once, the Capitol is free to get in and out of again, you may want to go to the Capitol and meet the person that you Zoomed with today, meet them in person. And, and it's a great entry to say, hey, we had that Zoom meeting. I just wanted to come by and meet you in person. Really appreciate your time, appreciate your support. Those are the kinds of things you can do after session to further that relationship. You move forward, Jason. Thank you. Also, one of the things you can do is send information back to them. And we presented this resource material during ABCs of Advocacy, but we just wanted to include it again. And we have a number of resources available for you. There's 4 different sheets, and one of them identifies the social and economic cost of substance use. The flip side of that sheet looks at the social and economic savings of a system of care. There's another one about the, has to do, there you go, Jason, has to do with, this is the full continuum of care. And this is a 2-sided document. You can roll to the next side, Jason. And this is the flip side of that document. So it outlines all the various types of services that are provided across the continuum of care. Go ahead, Jason. This is the one we just talked about, the social and economic costs. I think they're on, the slides are actually on here, Jason. There you go. This is being a champion. You can ask your representative. These are ways that you can ask them to support your work, your organization. So the group that you're a part of. And these are all available to you through the Google Doc link that we sent. And you can send these to them in a follow-up email. And there's also another great one on here. Let's just go. There's the substance use disorder in Texas. This is 2 pages, one page front and back, chocked full of facts about the impacts of substance use disorder in Texas, as well as the positive impacts of prevention, treatment, and recovery services. So this is a great resource. It is well-resourced, well-researched. The references are where you can find the references are available on there, and it gives you some just hard and fast information. So again, good follow-up material that you can pass on. Okay, one last opportunity for questions and answers before we hop off and start making those appointments. We have had several additional appointments that have come in this morning, and Elizabeth has updated those on the Google Doc as we've been getting those. Is there, do we need to send that? Elizabeth, will the link that they have go to the updated version?
Oh, yeah.
Okay.
It's updated in lifetime.
Okay. So you should, if you didn't see an appointment and we told you that there was one for your person, you might go back and look again. We may have been, we've had several people that were able to get appointments this morning that they've been trying to get for days and weeks. So it is a very much a fluid process. So Jason just dropped that appointment thing in there.
I think this is pretty minimized, but there may be 1 or 2 appointments where all we have is the time and the person the district lead who set the appointment. If that's the case, please reach out to that district lead. We've not been able to get that information for you. So it'd be real important for you to reach out to the district lead who set the appointment, and all that's on the spreadsheet.
Thriving United here in Midland, and we are setting up our Zoom. Thriving United, specifically what senator is that?
I think it's Seliger.
That's Seliger. I think we put that information in the Google Drive. So, okay, well, if there's no more questions, then we are going to close this meeting. And constituent groups, y'all have received emails that had all the constituents for a particular senator in that. So if you want to reach out to each other and set up a time to connect, if you have not done that already, this would be a great time to do that. And will you please send myself or Elizabeth an email and let us know how your meeting went today. And if you have a meeting in the future, will you let us know when you have that meeting and when that meeting how that meeting went. We really want to know how things are going. Jackie, you're asking, is my appointment time 4 o'clock? We don't know who your appointment is with. We need a little more information from you.
And Sherry, I would just also like to reiterate, if you have a chance, you can sign on to that Zoom 15 minutes early. That would be really important just for the whole group to kind of, get a feel for who's going to talk and under what subject.
And Claudette, I saw your comment about that you've reached out to your district lead, but have not heard back with an email. I think at this point, I would just continue to try to reach out to them. I can get with maybe Elizabeth and try to figure out who that lead is to see if we have a different contact. But just continue to reach out to them.
Is it bye-bye time?
Yeah. Thanks, everybody, for attending with, and sorry for all the technical difficulties. The important thing now is to make your meetings with your senators and your representatives. And even though today is a recovery day at the Capitol, for me, every day should be recovery day at the Capitol. So just keep
Absolutely.
reaching out to your senators and to your representatives, even beyond today, and create those relationships and still keep championing for prevention, treatment, and recovery support.
Yes.
Absolutely. Thanks,
Onward.
y'all. On to the next.
Go fight, win.